Hi everyone, my name is Andrew Biggers. I'm a doctor of physical therapy and a fitness coach here at Limitless Therapy Services and Limitless Online. And today we're going to be talking about banded mobilizations. Today we're going to be talking about a few ways you can use a resistance band to help with shoulder mobility. This can be useful if you're limited with overhead mobility or if you're getting some pinching in the front of the shoulder. But if you're having pain with any of these, then it might not be the best movement for you to do at the time. And so I'm gonna jump right into it and get started. First thing that you'll need is a resistance band, and one that's fairly strong. This one here is a pretty strong resistance band, and I have it tied onto a rig here, or a squat rack. And so when you're putting this on, you wanna make sure that it's up high on the shoulder. Not on the side of your shoulder where your chest is, but really high up on your arm, okay? And then from there, you're leaning into the band. So when I'm leaning into the band, I'm not getting any pain. I'm feeling a little bit of a stretch here. If you are getting some pinching or if you're getting discomfort there, you can try doing a little bit less pressure into the band and not leaning into it as much. But the goal here is that I'm getting a slight glide of the joint in the backwards direction here, okay? And so by doing that, I'm helping to open up space in the front of the joint that could be limited when I'm trying to go overhead. And so from here, you can go into a couple of different positions. You can try bringing your hand up over your head this way, and that's gonna bias more of an external rotation of the shoulder, and then go ahead and lean into it that way. You can also come behind your back, which is gonna go more into internal rotation. And then once again, you're using your body weight to just lean into the resistance band. Now, when I do this, I'm making sure I'm not getting any numbness down my hand. It doesn't feel like my arm's falling asleep. Once again, like I said, I'm not getting any sharp pinching here, but I am getting a bit of a stretch. Okay, I can even bring my arm out in front and go this way. And then as I get comfortable with the resistance band and I have a good idea of where I feel like I'm getting most of my restriction, then I'm gonna do what's called oscillations. And so I'm gonna be going in and out, not tugging as hard as I can, but actually taking my time and doing slight, almost like a little bounce here. And that's gonna help to mobilize the joint better, okay? And so, once again, when you do these drills like this, it's important that you retest your flexibility afterwards to see if it's actually helping for you. And so, reaching overhead, maybe doing both arms at the same time, and seeing if you're noticing that it improved your flexibility on that side. If not, it could be that you need to look more at soft tissue in the area or muscle tightness around the shoulder that could be restricting your range of motion. I'm gonna get into one more other mobilization that you can do with the band here. And this one is just a simple distraction of the shoulder joint. If you're really hypermobile, this might not be the right thing for you to do because I don't want you distracting a joint that already is having a hard time being stable or has a history of subluxing or dislocating. But I'm gonna show you guys how to set this up. As you can see, I have the band up a little bit higher now, and it's not down at shoulder length the way that it was before. What I'm gonna do now is put my hand into the band, and I'm gonna close my hands here over it. From there, what you're doing is you're leaning away from the band and trying to use your body weight as a way to determine how much resistance you're getting. You're gonna feel a pull in the shoulder joint here. It shouldn't be causing any pain or discomfort, but you should feel almost like a decompression of the area. And that's exactly what we're looking for here. Okay everyone, so just to wrap things up a little bit, a few key points to remember when doing banded mobilizations. One is the placement of the band. So in this situation for the shoulder, very high up on the arm. Two, making sure that you actually have a band that's strong enough to perform this. And then 3, not having any pinching, sharp pain, or numbness and tingling going down into the arm. If you can do all those things correctly and you're not having discomfort, the last thing you want to do is make sure that you retest the movement and see if that movement has improved at all. That way you know if banded mobilizations are the right thing for you. If you found this video to be helpful, or you have more questions about banded mobilizations, please shoot us an email or send us a comment and we'll be happy to help.